you, I don't look a girl, but hey, taking anywhere.
That's weird.
That is certainly a lesion of one of the 12 cranial nerves.
Yeah,
Gotta be.
yeah, sounds about right. Yeah.
All right, sir, is it Mr. Olfactory, is it?
Yeah, I guess. Why am I here?
So we're doing a little investigation here, and you're a part of it. So can you tell me a little bit about yourself?
Yeah, I'm from the nasal mucosa. All I do is like sensory and stuff. I guess. I don't know. It's whatever.
Sir, this is serious. Please put your phone away.
No. All I do is sensory for like smell and taste. That's all I do. Okay?
That's all we need to hear.
If I was a lesion, you wouldn't even smell it out anyway.
State your name, birthplace, occupation, please.
Dr. Glasso P. Hurringio, originally from medulla to city and brainstem. Sensory fiber by day, motor by night, and parasympathetic every once in a while.
What are the jobs? Please enlighten me.
So every day it's the same thing. Go from Jugular Freeman Road to the coffee shop, grab a coffee. From there, I go help my buddy, posterior tongue the third, taste it. From there, I gotta go down and see my boy Stylo P, Stylopharyngeus, help him motor innervate, make sure the coffee goes down the right tube, if you know what I'm saying.
Are you telling me your entire job revolves around tasting coffee all day?
Coffee, orange juice.
You mentioned 2 jobs. You said you had 3?
Yeah. I have the part-time job at Parasympathetic Inc. I'm actually the manager of the parotid gland, the largest salivary producer in the region.
Impressive.
Not
Yes.
bad.
I mean, do you take any time off? Seems like you're working like a dog.
I can't afford to. Without me, salivary production takes a huge hit. I mean, the submandibular and sublingual, they can kind of cover, but it's hard without me and the parotid. And then sensory and motor, I mean, you're gonna have things going down your trachea instead of your esophagus. Can't really taste at the back of your tongue. It's not a good look if I take a day off.
What do you think?
I don't think he's our guy.
He's not our guy.
So, accessory spinal nerve. Where are you from?
I'm originally from the medulla, but I've spent some time down in cervical nerve roots, C1 through 5, Came up through the foramen magnum, rejoined my cranial root, and we're living outside of the jugular foramen for a while now.
Okay. It says here you're strictly involved in motor.
Strictly motor, just, my spinal part does the good old traps and sternocleidomastoid. Larynx, pharynx are covered by the cranial section.
Okay. Enough of that. Let's focus on what kind of trouble you've been getting around to.
I'd rather not divulge in my past. It's very long and hard to explain. I'm totally through that side of my life. All I've been doing is motor. All that stuff never happened for all I care.
I can get the records easy. I'd rather hear it from you though.
Okay, I've been known to cause paralysis of the ipsilateral sternocleidomastoid and traps, but that's it, I swear. That's it.
What's your deal?
Hey man, I'm just cranial nerve 3. I'm ocular motor.
What do you do?
I control the pupil movements and I control the eye movements.
Where are you from?
From the superior colliculi.
And you control eye movements.
Yes, sir.
Do we believe that?
Mhm.
Don't move your head.
All right.
Look over here. Look over here. Look over here. I think he's telling the truth.
See, I told you it could have been me.
I don't think it is.
All right, Mr. Abdusons, is it?
Yeah.
I haven't really heard of you. What are you up to these days?
I don't really do much. I don't go outside of my home in the pontomedullary junction, and all I do for work is to supply the lateral rectus muscle. All that does is abduct the eye.
Okay, that's okay. You seem a little nervous. Let's calm down a little bit. We'll lay off.
All right.
We'll come back to you. Okay.
I wish I could give you guys some more information, but
Okay.
I couldn't really see very well last night.
Yeah, you're fine, buddy. We'll take care of you later.
Yep, it'll be fine. Just relax, okay? So, you're the, what nerve are you?
Vestibulocochlear nerve.
Vestibulocochlear, huh? Where are you from?
Okay, can we please quiet down a little bit? I can already hear everything, so it's a little too much, okay?
I apologize. Where are you from?
So I'm actually neighbors with the facial nerve, so right at the pontomedullary junction.
What do you do?
So I'm mainly involved in hearing and balance, so mainly sensory stuff.
If I told you that the facial nerve saw you close to the lesion last night, what would you have to say about that?
I would say that's impossible. I mean, if it was me, there would be ipsilateral hearing loss in one ear, and I haven't done that in years.
Interesting. Thank you. That'll be all.
All right, tell me a little bit about yourself.
In 1 second, let me finish this page. What do you want to know? I'm optic. All I do is photoreceptors. That's where I come from. That's where I go. And then after that, I just do sensory of vision. That's all I do.
What happens if something wrong with you?
You just can't see. That's it. That's all. I told you everything I know.
Let's go.
Viva Las Vegas! Who's dealing?
No one's dealing. Who are you?
Cranial nerve 10.
What's your deal?
Well, there's a lot that I do and a lot that I don't do, you know? Is it a crime to be so involved in the body? Is it a crime to innervate the larynx, the pharynx, and the viscera? To decrease the heart rate and constrict the bronchi? Am I guilty?
No, this isn't a court. We're just getting an interview. Nice and friendly.
You need to relax. Calm down a bit.
Hey!
Hey, man, calm down. It's gonna be all right. Let's finish this interview.
Cigarette, bud?
Fine. Tell me this. You ever walk down any dark alleys in Vegas at all?
Never. Only the one from my house on Medulla Street, right through the drug dealer for Raymond. Comes out next to Caesar's Palace, actually.
You ever leave Vegas, or is party life too good for you?
Me? Leave Vegas? Do you know who I am? 80 to 85% of the parasympathetic activity in that town runs through me. Without me, no swallowing, no speech, barely any digestion, your jaw's gonna start elevating all wonky. Where can I go?
Smoking is bad. Don't do it.
What are you, crazy?
Where are you from?
Medulla! I exit the hypoglossal canal. What do you think?
What do you do?
I swear all I do is motor innervation of the intrinsics and extrinsics of the tongue. That's it.
That's not good enough.
I swear I'm telling you everything. Okay. Ipsilateral atrophy of the tongue. Whenever you point out your tongue, it'll deviate towards the effective side. Okay, you might have difficulty speaking or swallowing, but that's it. I swear. No.
Who are you? I'm a trochlear nerve. They call me cranial nerve 4.
Cranial nerve 4, huh? Where are you from?
From the inferior colliculi.
Is that right?
It is.
What do you do?
I control the superior oblique muscle. See, if I were to cause this lesion, I would have double vision.
We have a way to prove that? There's only one way. Do it. How many fingers am I holding up?
2.
It's not him. It's off the book.
Tell me everything.
I don't want to be here.
I want to go home.
Shut up, you two. We're the trigeminal nerve. We have an ophthalmic division that provides sensory from the upper face and the eye, and we have a maxillary division that provides sensory from the nose and the upper teeth, and we even have a mandibular division from the lower face, tongue, and teeth
Oh, you're so
that
smart.
provide sensory and motor. We are much too busy to be wasting our time with something like this. Plus, if we would have done it, they wouldn't be able to blink, and their jaw would be deviated ipsilaterally.
Oh, you would say that. That sucks, man.
Facial nerve, right?
Yeah.
Where are you from?
So if you're familiar with the pons, the medulla, I'm right between there at the pontomedullary junction.
Okay. And what do you do for a living?
So I actually have a pretty diverse skill set, both sensory and motor. So I help in facial expressions and also provide taste to the anterior 2/3 of the tongue.
Interesting. Well, according to your criminal history, it says that you can cause Bell's palsy and drooping of half of your face.
I will not confirm nor deny those allegations.
Is that right?
Yeah.
So in other words, you need a lawyer in order to continue?
Already called one.
Are you aware that you needing a lawyer is suspicious?
I'm fine with it.
All right, sir. The autopsy's back. Take a look.
So, after further investigation, it's been found the symptoms have been found to be no abduction of the eye and diplopia, also known as double vision. So now we're leaving it up to you to figure out which cranial nerve is causing this lesion.